Hello, everyone, and welcome to Ben Snap and Chat. It's season 1, and it's episode 5. And today we're talking about medical PTSD. And I have my sidekick, Batwoman, co-host with me today.
Cristie Vito, very excited to be here.
Femme extreme extraordinaire.
I love it. I love it.
How's your PTSD, Cristie?
We're just jumping right in there, aren't we, today?
Who's going first? Listen, I think you should go first. Ladies first, because
ladies first.
Yeah, I'm always about that, you know. By the way, let's talk about that for 1 second before we get into the medical PTSD. Yes. Some people that are female don't like this anymore. I've tried to do this for people, and some people get insulted. Some women get insulted when you hold doors for them now. Did you know that?
What? Are you... Yeah. That honestly, that makes me a little sad.
Some feminists don't want that. They can say they can hold their own door.
See, I'm a very vocal feminist, and I love the chivalry.
That's all I needed to hear. Thank you very much. And on to medical PTSD, I'll be sure to hold the door for you the next time.
I love it. Thank you.
You go first. So let's talk about medical PTSD. Today it's all about, of course, if you have had a chronic health condition or something that is not something you can put your finger on, like where they can go, oh, you have cancer, God forbid, or you have heart disease, God forbid, where, you know, it's much more deeper, below the surface.
Which I thought was maybe an interesting time to actually talk about why we're called zebras. Because we've kind of talked about us as zebras.
Yeah, somebody asked this on one of the Either Stanlow's pages
you saw that as well. Okay,
I did. Yeah, we're looking at the same stuff.
Oh, okay. Of course, and we're so in line. So basically, for those of you that are new and maybe like starting your EDS journey, the reason that we're actually called zebras is that in medical school, doctors are told when you hear hoofbeats, think of a horse, which basically translates into think of the most common possible reason to explain the symptoms that this patient might be experiencing. Now, a zebra is going to sound exactly like a horse, but we are completely different animals and need to be treated that way. And you know what? There are people there. We do exist, these rare cases, and a lot of times, you know, we get either dismissed or we get told it's in your head. We get misdiagnosed. And the reason is because we're not the typical, and a lot of doctors have never seen patients with EDS.
Well, they have. They just don't know what they're looking at.
Exactly.
Yeah.
But I mean, the number of times I've gone to the ER and both doctors and nurses alike have never heard of EDS, have never heard of POTS. So, I mean, do we want to just dive in and like share some of the things that we've gone through?
The other thing that I read about zebras is that every zebra has different stripes.
Yes, that's another good point. So we're not all the same.
I'm thinking about getting a zebra tattoo.
So am I.
But I have PTSD from the last time I got a tattoo.
What happened? What gave you PTSD?
I had like major nerve damage. I couldn't figure it out. So it's the first big tattoo I ever got. It's a tribal thing I've got on the left-hand side of my body.
Okay.
And I still love it to this day.
Yeah.
But it took almost 3 months for the nerve pain. So it felt like after I had it done, and I thought this was temporary, it felt like somebody took an iron that was on high and put it on my skin 24/7. That's what it felt like.
That is absolutely horrible.
We didn't know what was going on. So it was just like, oh, you know, must be sensitive, or maybe I'm allergic to the ink or blah. But what it was it's a connective tissue disorder. So people with connective tissue disorders have different nerve sensitivities. And I'm unfortunately one of them. And I did have a 3-month stint of going around with an ice pack trying to cool down what wasn't really hot. It was mostly, it was all nerve. It was all nerve conductivity. It was terrifying. And I'd love to get a zebra tattoo, though. I want one.
So do I. Like, I only have a tiny little tattoo on my neck, which I got before any kind of diagnosis, but I've always had a wonky neck. And I remember my dad, when I did get my diagnosis, he's like, could it have been the tattoo? I'm like, it's very small, and it didn't hurt me when I had it.
It's not the tattoos. Like, I mean, there's so many millions of people get tattoos, and millions of people don't have, don't get EDS from tattoos.
Exactly.
You know, But yeah, so let's just jump in.
Yeah. So for me, when I think
And we
of
are
like,
talking about today the problems that EDS people have when we go to
yes,
doctors because of the invisibility of it.
and we develop medical PTSD specifically when we've experienced trauma, when we've been gaslit, when, you know, our experiences are dismissed and told, oh, it's just anxiety, which I think most of the zebras listening can relate to that. So for me, the moment where for me it was like a big turning point, and it kind of helped with my advocacy as well, is so post surgery. So after my big first surgery, my ileostomy surgery,
Mm-hmm.
I was the weakest that I had ever been in my entire life, and the most vulnerable. And for the first 3 days post op, I was begging for water.
Okay.
And for 3 days, they refused. They only gave me ice chips, literally for 3 days.
Yeah, because of
And
the liability with choking
with choking, but I'm trying to explain to them. So I was having post-op, a lot of my complications were actually related to my POTS
and
and
dehydration.
in
Yeah.
dehydration. And
Right.
so my blood pressure was all over the place, my heart
Mm.
rate, and I'm telling them, this is my POTS. Like, I need to drink. And a lot of doctors, like, they didn't, first of all, even understand what POTS was. And I'm telling them, POTS can affect the amount of volume of our blood, which is part of the reason why we actually need to drink so much water. Like, I drink 2 to 3 liters of electrolytes a day, and they're trying to tell me, oh, you're good with the saline. And I'm
Mm-hmm.
like, I can feel that I'm dehydrated.
Yeah.
And so after 3 days of them refusing,
Starving you
uh,
out of water. Yeah.
yeah, I kind of,
Why 3 days though? Because usually
I
it's like a
don't,
24-hour period, right?
I don't know. They
Post
ended it.
surgical.
Yeah, and then they put an NG tube down my, which, if anyone's had that done, like when they're awake, it's not a pleasant experience to have this tube
Terrible.
shoved
My
down. It's,
dad. Do you know that
ugh,
tube that's got the? Is that the tube that's got the bulb on the end of it that vacuums out your stomach?
yes,
Okay,
yes,
so my dad had, dad had the same kind of
yeah,
surgery. Only they
yeah,
only took portion of his bowel out because
yeah,
dad had this autoimmune thing too. So anyway, when they were pulling the thing up,
yeah.
the bowel at the end,
No, don't tell me.
it burst. Yeah, I'll never forget that. Isn't there mercury in that?
I don't know, but that does not. That's
Oh, it
not.
was horrible. It was really horrible. He got really sick. I can't, and I don't want to be giving false information ever,
Yes,
but
yeah,
I think there was some type of mercury involved from what I remember. I mean, I was 12 at the time,
yeah.
but yeah, I remember him being really sick, having that down and watching that thing vacuum his stomach out when, so the bowel wouldn't take any food on.
Exactly. And so that's
Yeah.
what they were doing, trying to. What they were saying was that they were doing it to try to help the stoma work.
Yeah.
And so me being me, and I'm like, I need something. And so I asked my dad to sneak in some Gatorade for me because I was so thirsty. I knew that the root of what was happening to me was because of the POTS, and that I desperately needed to drink. And so I drank right away. I drank like 2 bottles of Gatorade, and
Yeah.
I'm not saying Gatorade was probably not the best thing for me to
Well, we
drink.
didn't know any better. We can talk about that during the nutrition part.
Another, exactly.
Yeah.
But because I had the NG tube in,
Yeah.
I pissed off my doctors
Yeah.
because I had red Gatorade, and so they thought I was bleeding.
Oh.
Yeah, so they were not impressed with me. I
Oh.
literally heard them, the resident that was overseeing me, and
You're a problem.
I
You're
was a
too much, Cristie.
hypochondriac. I was a
Yeah.
hypochondriac.
Well,
However,
after this surgery, though, I'm going to tell
but
you, I don't think people understand how
it,
messy and awful
it's
bowel surgery is.
it's not pleasant.
Ick.
Seeing your
We talk a lot
like
about poop and bowels on this podcast. It's the Bend, Chat, Snap, and Poop podcast.
we should rename it.
People are going to be going, you know, those two, they got a pretty good podcast, but they talk about shit an awful lot.
Talk about shit all the time, like every episode.
Hey, you know, it's a real big. I'm really realizing that this whole bowel and intestinal thing and the slowing down of your intestinal tract because of the connective tissue being faulty, this is a big part of having this thing. And
it
this
really is.
My, you know, thing about, I have PTSD about pooping, for God's sakes. It's like,
I mean,
you know,
you want to get started on that?
No, we don't want to go there yet.
That's
yet. The second half of the episode. But yeah, so you have PTSD over this surgery.
Yeah.
I mean, surgeries in general, I find. If somebody told me I had to have surgery, I would have PTSD because of my experience. And my experience was 12 years old. This is when the teacher sent me home, right?
Yeah.
Remember that? I remember told that story before. Yeah. Teacher sends me home. If you haven't listened to the previous episodes, which you should be doing, you should be up to number 4 by now.
We hope you are.
Like yeah, hopefully you are. Then you already know that the teacher kicked me out of the classroom and sent me walking home with a ruptured appendix, and I ended up in the hospital. But long story short is, when they did the surgery, they took the sutures out exactly at the time that was recommended, which was like 10 days after the surgery. Yeah. And what happened was my stomach burst open and I got a septic infection, and I ended up I almost died.
You almost, because sepsis. Yeah, you don't play around with sepsis.
No, so I was in, this is gross. Prepare yourselves.
I'm prepared.
So I was in quarantine for 30 days. Only my mother and father were allowed in the room, capped and gowned. And they would come in with these. I had this massive bubble of green pea soup like pus that was on the right side, of course, where the appendectomy was done. Yes. And I'm not kidding you. You know, the child's, not the small little ball like the bouncy ones you get, but the medium-sized one?
Yeah.
It was that big.
Wow.
It had stretched my skin. It was full of pus. And what they did was, because they didn't want to break it, because it would be too raw underneath. So what they did was they come in with these hot pads, and they would put these hot pads on it. It would break just a little bit, and it would release some of the infection. And they did this. That sounds
painful.
It wasn't painful. It was just uncomfortable.
Okay. So like pressure.
They had me doped up, and I was loaded with antibiotics. I mean, I almost died.
So, a sepsis is not something.
And I remember just being in there for a month, and what it was the stitches were taken out too early. People with EDS need at least 2 weeks.
Yeah.
And they need to be double stitched too. So that's the other thing. So I have medical PTSD from that. So if anybody tells me I have to have surgery, I am going to grill that doctor.
Yeah.
Like, I would have to sit there and say, okay, here's my previous experiences with any type of procedure. This is what happened. Here's what they did. Here's what they didn't do. Here's what they did wrong. Yeah. And I'm sure he's going to think, oh my God, this guy doesn't think I know what I'm doing, because most people take everything personally these days.
Yeah.
But it's our trauma. And I think what a lot of doctors don't realize is how much we're owning it because of how much we're exposed to it.
Exactly.
Right?
Yeah. Yeah.
So this is what happened to me when I first went to the doctor after that performance I did, where I knew there was something wrong with me. Being that off balance was like, oh, why am I so off balance? And then came this really severe pain in my SI joint and this inability to really walk straight. And so I went to the doctor, and she did a CT scan, and we know that most of this stuff doesn't show up in a CT scan, by the way. And if you're going to your doctor and all they do is a CT scan and they tell you nothing's wrong with you, keep going.
Trust yourself. Honestly, trust. You're the expert of your body. If you feel like there's something wrong, chances are there's something wrong. Yeah. So it's like taking that power back, because I totally, we're so used to thinking like, oh, the doctor knows everything, and the doctor doesn't.
We're back to that, the God syndrome that a lot of people, and I don't want to trash the whole medical system, because I've got.
No, I have some amazing doctors.
Me too.
I really have.
But I had to fight to get there.
Yeah, me too.
The fight to get there. Let's talk about the fight to get there. So my fight to get there started with the doctor who, and we went to, this was on CTV, by the way. I don't know how many people realize that. Yeah, we were on CTV with this. So that was the doctor that told me I had HPV in my rectum because he was biased against LGBTQ people. He was from Africa.
Yeah.
And he was a staunch, like, right-wing
Christian.
Kind of Christian.
Yeah.
Yeah. Yeah. And he was the guy that was capped and gowned for our first little hello, I'm your new
which
doctor
is insane.
And that's when he came out with the diagnosis of that. I mean, that's when I left the office, and good thing I had a few $1,000s I could take and go into the private system and prove my point, which I did.
Yeah.
And that's what I recommend you do.
It's hard though, because we're in Canada And we're told like, oh, like we have one of the best healthcare like systems in the world. And in a lot of cases we do. If I had cancer, I'd want to be in Canada. If I got in a car accident or had a stroke or, I'd want to be in Canada. But there's such a big part that's missing.
Even here, yep.
Yeah.
And, I will say, if you have the money and you have cooperative medical practitioners in the US, the resources in the US are better.
They are,
For
because
EDS,
everyone
if you have
like you
EDS,
pay for it.
HEDS, you have vascular EDS, you have like anything like that. If you have the money to pay for it, then you have accessibility. And here we are back to the privilege, right?
Yeah.
So many people don't have that privilege.
Not in the disability community.
No, because my MRI was $3,000. And I had to take it out of my pocket, cash, and needed to be paid. It was, and if I hadn't have done that MRI, they never would have seen that I had, at that current time, there was widespread osteoarthritis everywhere, severe inflammation. There was a bulging disc, and there was 2 labral tears. Both of my hips were torn at that time.
Yeah.
They still are.
Yeah.
But that's what proved that. So when I had the CT scan that came back negative, where does my PTSD come from?
Exactly. We're so used to having these tests come back and showing, it looks okay, or it looks normal, or it's in range of whatever they expect.
It's in range of what we call range, but
exactly.
we don't really take into consideration that everybody's genetics are different, and that one point to somebody can be like a tenfold for another person.
Which honestly is part of what led me to start comparing my own results and looking back and be like, okay, where they're saying that this is still okay, but I'm not feeling the greatest. And so I go back and I look at like the trends of what has been happening. And a lot of times when I do that, I go back and it is slowly increasing or decreasing, whatever the case may be. But people don't tell us that. We just assume that they're doing that or they have our best interests in it, but they don't. They don't have enough time.
My doctor is the guy that I ended up with, because the guy that totally abused me and kicked me out of the office and told me I had the HPV in my rectum.
I can't even.
It was his boss that took me on as a patient. Once he found out what this guy did to me.
The bias.
Yeah, the bias. He took me on as a patient, and this is when he said, okay, we got multiple things that we have to address. We did an MRI. Now, on the MRI was the foraminal stenosis. And if you're not familiar with foraminal stenosis, it's where the nerves come out of your so I have C-spine foraminal stenosis. And what happens is where your nerves come out of the channels into the little holes in your spine to go down through your body. What's happening is the little holes where they come out, mine are narrowing. It's caused from the severe osteoarthritis, from the instability from the EDS. Because what's happening is everything's moving around too much, and that wear and tear is causing osteoarthritis, and the osteoarthritis is causing the foraminal stenosis. We have the domino effect. So this was present on the MRI.
Yeah.
So with foraminal stenosis, you can have all kinds of problems. You can have bowel and bladder, and you can have digestive problems. You can have personality issues, as to which I was displaying all of. So I had personality changes. I was angry. I was aggressive. I was not going to the bathroom very well. My food was taking forever to digest. And he never once. I don't think
any of that.
And the reason why he told me he didn't tell me I had foraminal stenosis, I think he didn't want me to get really stressed. And he was monitoring. He knew that we were doing what we could and monitoring. But when I sent my MRI down to Robin Fogg in Colorado, who I've been working with for the EDS. She's a pain management and nutrition and lifestyle specialist. She's a specialist in all this stuff, lifestyle specialist for people with EDS. And she told me, she said, oh, you've got like foraminal stenosis and this, and this. And, I'm like, and then I got Michael to look it up because we have access to it, and it was there. So I have a considerable, what they call a considerable or notable foraminal stenosis, which means that it's bad enough.
It's significant. It's significant enough for them to find it. But
so here's the fine line, though. So here's the fine line. So the fine line is he didn't really tell me. He did tell me I had inflammation in my neck, to be fair. And he said, okay, there's disc problems in your neck and you have bone spurs in your neck. He gave me all of the issues around that, but he didn't diagnose it.
Why do you think that they do that? Because your experience is
Stress.
not unique.
Stress. Because I get so wound up. I have so much PTSD about having something that, and there's issues with my mother, because my mother
Yeah.
was always worried about having some type of medical affliction. She had a cancer thing. So
Okay. Yeah.
she was terrified of having cancer.
Yeah.
And that was her whole life, being obsessed with, and she would tell me this all the time, oh, I'm going to die of cancer. And I think I have cancer. And it did something mentally to me.
I mean, of course.
So
Like if
now
you're,
I'm very reactive to having anything because of that conditioning. And yes, I'm blaming her because she perpetuated that upon me. And
yeah.
now, did she do it intentionally? I don't think so. I think she was mentally tortured, to be
Yeah.
honest.
Yeah.
Our parents come from a different generation,
They
and
do.
yep. And so my mother was always instilled this fear of medical things in me. And on top of it, my mother has this, I have this, and it's really complicated. And what happens is when I have something, I think the doctor knew if he told me I was going to obsess and I was going to be really stressed about it. So he gave me all the details and said, okay, this is normal for what is happening to you and what's wrong there, but didn't quite name it.
But doesn't that lead to part of the not trusting the doctors if they can't, like for me, I understand that perspective of not wanting to cause more stress, but people, like for me, I want to know the
So do I.
details.
I'm 56 years, almost 56 years old now. And I told him, I sat him down. I had an appointment. I said, listen, I said, I know what this is now. I said, this is foraminal stenosis. It's fairly serious.
Yeah,
I said, it's getting worse. I said, so
exactly.
now I want to talk about what we can do about it.
Because then what? They're going to wait until it gets too bad that what you need to have surgical
and
intervention?
then I'm going to need surgery. Whereas if I address it now with,
yes.
we know I'm going for, we don't know yet. I just got my appointment today from the specialist here.
Yes, we were just talking about that.
One of the top specialists in orthosurgery and platelet-rich plasma therapy. It's an injection therapy. They inject your neck with needles. And it's or prolotherapy, where they inject a dextrose, I think, solution multiple times into the neck, and they damage basically the ligaments enough so that your body picks up and goes, oh, there's some type of injury here, and it goes and improves everything. But so that's where, I can intervene if I know what's wrong with me.
Exactly.
I can take the lighter treatment and see if that works before I head to a more radical one.
So when Robin went through this with you and it kind of explained, like, this is actually what's going on.
Yeah.
Did you spiral, or did you feel like, okay, now I have something that I can understand?
I spiraled into validity.
Yes.
Yeah. I spiraled into
powerful.
The personality changes, the anger, the aggression. Oh, that's because I got a major nerve being choked off in my neck. Oh, that's how I felt.
But this is why we get PTSD, because how can we trust doctors if they're not giving us the full picture?
Yes.
And before we jumped on here, you were talking about you just got this appointment and stuff, and being able to trust doctors, like how has that now impacted you going into new appointments and seeing new doctors? Like, what does that look and feel like to you?
Oh, God. When I go to new ones.
Yeah, the new ones are the biggest. I think.
Like right now, I have all these. I have Dr. Isabel in Prevo.
Yeah.
I can't remember the name of her clinic because I always mess it up. But she takes care. She's a Atlas orthogonal specialist in necks with chiropractic, and she takes care of my neck.
Yeah.
I have my GP, and I have Robin that I've been working with, right? And then I have the specialist in Montreal that just diagnosed me that I have a year window. I can go back to her if I need her within the year.
Okay.
But I've been referred to a gastroenterologist because, I have IBS and all kinds of weird stuff.
Yeah.
And, just going and having to explain all this stuff. For the first thing I say to them is that, do you know what EDS is?
That's what I start with now too.
Yeah. So if you are, I think, what we'll do is we'll keep talking about this and tell me about your experience this way too. But at the halfway point, I think what we need to do is start to tell people what we've done.
Yeah.
Because it's easy to sit here and rant about all these people that have been a pain in the arse.
For sure.
Because some people in the medical system are a pain in the arse to EDS people.
It's
And
true.
let's be honest here. We said we were going to be honest. It's a
Yeah.
real minefield out there, and many women,
Uh,
especially because
yeah.
90% of women are diagnosed with this over
Yeah.
above men, because
Yeah.
men don't talk about this, and that's this is a whole other
It's a
frustration. But
whole
anyway,
other, yeah.
so let's talk about how we navigated it and what we do now. So what's your kind of experience with this whole calamity?
So, for instance, like I saw a new neurologist recently, and honestly, what I do is I write everything. I do my own little research about the things that, I want to talk about. I went in specifically because I've been having small fiber neuropathy in my hands for the last year.
Yeah, so
I
that's
can't
like
really feel anything.
so people who don't know what that is,
Yeah,
that's like a tingling and a kind of like your hands go numb.
for me, it's all of that. It feels like a glove. So it's like on the tops and bottoms of my hand, and it
So it
kind of
feels like
goes
there's
up to
something
my elbow.
covering it. Weird.
Yeah,
Okay.
it's like I'm wearing like a
Something.
plastic glove or something.
Oh, kinky.
Yeah, right.
That was the last
That
episode.
was I
Sorry.
was gonna say that was that was
Yeah. All right. Sorry, I get distracted. ADHD.
that's the
It's ADHD time
thing.
with Drake on the Bend Snap and Chat podcast.
It's
Sorry.
the poop and the
Sorry,
ADHD. Like
Kirsty. Sorry. Keep
it's
going.
okay.
Gloves.
Gloves. So I mentally prepare myself. I do, like, before I even get out of my car, I do some deep breathing and just to mentally prepare myself to go in to a new doctor because I
Yeah.
don't know what I'm going to get. Am I going to
No.
get the doctor who just rolls his eyes at me and is like,
Yeah.
it's all in your head and you have anxiety because you're a woman and
Yeah.
doesn't understand EDS and POTS or any of
Yeah.
the other?
Uh-huh.
And so, but I also have my notebook. And so, because of my brain fog, I could be mid conversation and it just vanishes, like
Yep.
literally halfway talking.
Yep.
And I
That
use
happens.
it really does. And
This
it
is why
also,
I bring Michael with me. I'm lucky that
well,
way.
that's one of the things. Like, at first, my mom would be like, "Can I come with you?" And at first, I was really like, "Eh." I
Mm,
It was
you
an
know,
independence thing, and I was like, "I
you
can
should
handle this."
always have somebody with you. If you have EDS, this is a good. So let's stop here for a minute because you
Yeah,
made a very good point.
yeah,
If you have EDS and you're going to doctor's appointments, there's two things that you can do to really help yourself. One of them is start like some type of list, whether you tangibly write it down, you
yeah,
write it in your phone or whatever, of the symptoms you're having.
yeah.
And the other thing that is very tangible is making sure that you have somebody with you when you go,
It,
because of the brain fog issue with EDS. Because, like you say, you get midstream, no pun
yeah,
intended,
yep.
and you have to stop because you've lost it. You lose that thought.
And sometimes, especially like I'll do that now. I'll bring my mom with me when I have like a big new doctor.
Yeah.
She wasn't available. Like they were traveling when I went to the neurologist. But like when I go see a new doctor, I've now started to have her come because it's also a perception thing because it can be information overload, which can be really overwhelming and overstimulating. Just being in a doctor's office can be overstimulating for a lot of us because
And on the flip side, I've seen
yeah,
doctors. Once I start with my list,
yeah.
I see doctors getting completely overwhelmed.
the over, the number of times where I've literally, you can see in the doctor's face when they're like, oh, this is a lot more complicated than they ever imagined. And so, like, we have what's called the Ottawa Hospital in Ottawa, which is like 4 different hospitals. And see, this I'm just telling you right now, it's the brain fog. Oh,
Yeah, that's what
so
happens.
when you deal with a lot of specialists, and I only realized this once I started having a lot of specialists, is that you have to talk to the resident or the fellow typically before talking to the actual doctor.
Yeah.
And I didn't realize that at first. And so
This is a trend a lot of times in learning hospitals.
that's the thing with the Ottawa Hospital. It is a learning
Yep.
hospital.
Yep.
And so I'm more than happy to talk to the residents, but every time I do, it doesn't take very much for until you see that look of like, shit.
What is
I
this?
don't know what this person is
Who is this
talking
chronic
about.
nutcase?
Exactly.
Crazy. They want to, that's when they probably go out and they make a note that they should write you some Ativan. Here's some Ativan. The neurological system is malfunctioning. But isn't that true though? So yes, you probably do need something like that. I mean, it's one of those things with this when you start listing off the laundry list of what's happening from head to toe.
Oh, and POTS, that's one of the things with POTS is that as it displays itself can be easily mixed up with anxiety.
Yeah, so POTS is postural orthostatic tachycardia syndrome.
Yes.
It's when your heart like races and goes into like this spastic pumping and pounding, and it feels like you're dying.
Yeah.
And they love to blame it on anxiety. Like they say, oh, you have anxiety. But a lot of times, and here's another trick, and I tell this to a lot of people, if you want to prove POTS to your doctor, the best thing you can do is get yourself an Apple Watch or something similar and start to wear it. And because what happens is the Apple Watch is going to pick up the events that where you're tachycardic, where your heart is beating too fast. And mine, like I had an episode last night. It lasted like 5 seconds. Mine have gotten to the point where ever since I've had the neck adjustment, and the vagus nerve is stabilized, there's been a difference. So it's reduced. Now, I'm not saying that POTS is caused constantly by vagus nerve disruption, because that's not true.
No.
But it can be caused by that.
It can be.
So
for sure.
For me, mine are very, very brief. My doctor diagnosed me with this right away. So he was like, okay, you have I had a great first couple of appointments with my GP. He's like, okay, he said, I think you're right about this. He said, I think you have this. He said, I think you have POTS. He said, and you definitely have dysautonomic nervous dysfunction. I'm like, yeah. I said, I know. And that was the beginning of the diagnostic journey, and him and I working together. And he's been great. Like, I don't want to ever like say, oh my God, my doctor didn't tell me this or didn't tell me that, because I think he's kept stuff from me so I don't get really stressed out, because he knows me. He knows me really well. And he was kind of he was preserving me, I think.
But is that helpful?
Well,
in the long run?
No, because it wasn't until the time that we really sat down and I said, look, I said, I know what's going on now. I said, my one of my EDS people in Colorado just read this MRI, and I have foraminal stenosis that's notable in a couple of places in my C-spine. Is this why I'm acting like I am? Is this why I can't go to the bathroom? Is this why I have nausea that comes onto me when I turn my head? And he's like, he looks at me and he's like, well, he said, I have explained to you. He said, you have bone spurs. He said, and this is what's causing all this. I said, yeah, but I said, what's causing the bone spurs cause the foraminal stenosis.
Exactly.
Right. So
it's that link.
It was that one little step that goes, oh, okay. So now you have, and I hate to say it, but we all like to be diagnosed with something.
Because it feels like then we have something tangible that we could potentially, hopefully do as a treatment, I think.
Yes. So if I had known I had EDS when I was in my 20s, I would have had a very, very different look at life. I would have done everything that I've done over the past 2 years, which is substantial.
Yes.
I'm a new person. I'm a different person than I've ever been.
Yeah.
And it's taken a long time to stabilize my nervous system after everything that's happened with my vertebrae in my neck. And it's a real process. But I think knowing, and this is what we're talking about, is knowing. When you can then look up. Let's face it, we got ChatGPT, and what ChatGPT will do is it'll just scan everything that's tangible on the internet and then give you a result. And you can say to ChatGPT, I have an instability in my neck these days, and here's what's happening. Here's my diagnosis. What type of exercises should I do? And I've done it.
And it's helpful.
I've done it.
There's people that are probably going to be upset with us about using ChatGPT and AI and stuff, because I've seen it in different groups. But if it helps, it's a tool. Like, I understand both sides of it, but whatever we can use as tools to help us to take back that power, because when your body is going haywire and you don't understand why, you feel like you have no control over anything.
And this is when you have to start to kind of treat yourself blindly.
Yeah. And that's,
that's what causes all this PTSD. And what I'm saying here, the thing is I want to make very clear that if you have any problems like this, you need to start making notes of it. You need to do the Apple Watch thing, and you need to go to your doctor.
The more data that you have to go and show them, like, this is what's happening, because they only see you for 15 minutes, however often you go to the doctor, right? And so you can only tell so much. And I think a lot of times we become like, it's easy to go down the rabbit hole of diagnosis.
Yeah.
I get it.
So you get how much time with your doctor?
Like 15, 20.
I get an hour every time I go.
See, now I've been able to like,
Lucky.
I'm lucky now that I have a doctor who, I'm lucky because my parents are able to afford to pay for me to have a private doctor.
Yeah, well, it's a form of privilege, right?
It is. And I acknowledge that, and I understand that I'm lucky for that. But so in that circumstance, the last time I was with her, I was there for like almost 3 hours. It was my annual. And so there's no limit in time. But when I had doctors previously, a lot of them, it's like, okay, yeah, 15 minutes.
Yeah, and that's what gives
pretty
me
much it.
That's what gives me PTSD, because the thing is that people with EDS, everything is connected, and you're having all of these problems because it's a connective tissue problem, which affects your whole body, which means that everything's happening at once, and you're only allowed to talk about one thing.
And then especially with specialists too, because there's a lot of overlap, and I find like I've been bounced around so many different specialists because they're like, in that like 15-minute appointment, we don't really sometimes don't get to talk about all the things that are actually happening that are related,
right?
Either neurologically or cardiology or whatever it might be.
Because you have this 15 minutes, or you get kicked out of the office and told you have some type of weird thing called HPV in your rectum.
Oh my God. I still can't believe that.
That's my medical PTSD. That's why I keep repeating it, because I'm over it. I'm over it now, but I will never forget it. And I use it as I use what happened to me as a sounding board when other people are talking to me about their medical experiences.
Well, even like what I was sharing, the irony of the entire situation for my PTSD moment was when the stoma nurse came to discharge me, and she was going, the very first thing she told me is hydration is the most important thing. You need to drink, drink, drink. And when I told her that they hadn't given me anything to drink for 3 days, she honestly was horrified and couldn't apologize more, because they were actually making my situation, regardless of the POTS, worse. Even if I didn't have POTS and just the stoma, they should have been giving me at least water.
I've never heard of this. Like I've heard like 24 hours after surgery, they do the little lemon sticky things, and where they put them on your lips, or they give you crushed ice. But I've never heard of like being starved of water for 3 days because they've got you on an IV. Weird. That's very weird. And I totally get why you have like PTSD. A total PTSD because what happens is when you have a major incident like that, where another doctor says, "Oh my God, why? You should have seen the specialist." I went into the system privately after I left the HPV and the rectum doctor in Maniwaki. Maniwaki, Quebec. Brand new doctor to the area. Such a shining star. Anyway, after I left his office, I went into the private system. So I made myself, found a rheumatologist with a great company called La Croix Medical in Laval. And they treated me very well. And the doctor was very good. He ordered my first MRI, and he said, "You need genetic testing." He said, "We need to rule out this and this." And he said, "But if we rule out this and this, then it's this." And he sent me on my medical journey. So that was a very good appointment, but he was pretty mortified when I told him what happened to me, much like your doctor, right? So
shocking.
When you start to see the medical professionals being mortified, that's when the PTSD starts to really rage, if you know what I mean. Right?
Because it justifies. Like
it justifies what you're thinking, because every once in a while, because there's a whole bunch of imposter syndrome with EDS,
which I understand, but
me too.
Because it's hard, especially when it's taking decades to get diagnosed. Like within those decades, stuff is happening in your body. Like
it's getting worse. It gets worse. It gets a lot worse. So mine was just like, I was hyperflexible. I had a painful sternum when I was 25, and my feet used to get really sore. But I was a hairdresser. I was standing up all day. So I thought you would just blame it on the normal, wear and tear of every day.
Yeah.
And, I was weightlifting and stuff. I was like, oh, you're just, really sore because you lifted too heavy. There was always an excuse.
Yes.
But as I got older, and when the nervous system stuff started to happen, and that started to go haywire, then it's like, okay, there's something really wrong with me.
Yeah.
And
Yeah.
and it's terrible that it took a chiropractor,
Wow.
because even my medical doctor, we hadn't done the MRI by that time. So
They refused. That's why you had to pay for it
no,
yourself.
the first one they refused, and then
Okay.
we hadn't done the second one by then, because I
Yeah.
needed
Okay.
another one on my neck.
Okay.
It's when I got to the chiropractor and he x-rayed me and he said, "Come here," he said, "I know you can see this." So he showed me all of the spots where the foraminal stenosis was. He says, "You have some type of damage here." He said, "You need," and he listed the MRI that I needed and what they needed to look at. And I took it
Interesting.
back and I had an Atlas adjustment that first
Yeah.
appointment too. That was in Markham with Dr. John Baird. He's amazing. But I took that form, actually, or email, I think he sent, and he recommended that my doctor order this MRI, and he did. And it was when this MRI was ordered, we found out about all the problems.
Wow.
So,
Okay.
yeah. So that's when, it was a chiropractor and so many people with EDS. And I had
I was
I
gonna
had a
say.
whole bunch of PTSD about going to a chiropractor, because a lot of
Yes.
people, I've read a lot of stuff on
Yeah.
forums,
Yeah.
don't go to a chiropractor and blah, blah, because I had all my life.
You
And
did.
oh, yeah.
That's interesting.
I'd gone to chiropractors that were really manipulating like me. But
Can I ask you a question?
hmm?
So, do you think that the adjustments that you had, did you get your neck adjusted?
I
Like,
did.
could that be part of what has
Yes.
called this?
Yes.
Yeah.
Yes. So I think that
Mm.
between all of the wear and tear, I was in a
Yeah.
couple of accidents, and I was in
Yeah.
one instance, I was on a roller coaster, and it was roughly a year before
Okay.
everything started to go down hard. Now, the thing with Atlas stuff in your
Yeah.
neck, when that stuff starts to move, it doesn't happen overnight.
Yes.
So it's
Yeah.
it can happen gradually. The
Yeah.
destabilization happens gradually in the ligaments. So I went on a roller coaster at Six Flags in San Antonio.
Oh my
I
goodness.
have a Wonder Woman obsession. Like
Hello.
yeah,
Yes,
so
please.
Wonder Woman and my Jamie Summers, the Bionic Woman, were my two sheroes when I was growing up.
Love it.
And the Bionic Man. So those were
Yeah.
that was my top three. Oh, and Big Jim, but we'll talk about that some other day. But I'm sure you know why I like Big Jim, right? Yeah. So anyway, I'm getting distracted again. It's ADHD time with Drake.
I know.
Yeah. So the neck thing happened really, really slowly.
Yes.
But when the roller coaster incident happened and it came to an abrupt stop and I got thrown forward,
Eesh.
it finished it, I think. So
See, I was in a little like fender bender. Like
yeah.
it didn't scratch the car or anything, but I swear that was like Pandora's box for me. And it just
It can trigger everything.
Yeah, my
car
neck.
accidents. So when a car, just so people understand, because I'm a medical first responder, I've taken the course a couple of times and understand.
I didn't know that.
Yeah.
That's amazing.
Yeah, I probably forget half of it now. So it was amazing at one time. But I can save a life, and I have, by the way.
That's amazing.
So, yeah, I did that once. So with the whole thing with that, it's like with a car accident, if you're doing 70 kilometers an hour going down Innis Road, and you come to a stop, your body absorbs all in that abrupt stop. Your body would absorb all of the impact of going 70 kilometers an hour. It's compounded in one stop. And if you look,
a lot.
It's amazing what happens to the body in a car accident. And it doesn't take much. And for somebody like me, whose neck is so bad, yes, it can have like really, 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 really bad ramifications for my health. So I have to be really careful about neck jarring. I can't go on the Wonder Woman roller coaster anymore.
Aww.
Can't go on I love that crazy wooden roller coaster at La Ronde in Montreal, the Monster.
Yes.
And I can't go on that anymore because I'd done all this stuff during that time, and I didn't know that there was an instability in my neck.
Yeah.
So I was making it worse. So this is my PTSD now is like not just medical, it's living everyday life and wondering, oh God, am I going to fall and conk my head? So the PTSD goes well and beyond just the doctor's office, right? So we got 15 minutes left. So let's talk about you and what you think. What's the best advice that you could give people out there who are brand new to EDS? They've just kind of figured out, it's like, I may have this. My first doctor, how do they get to the specialist? Because there's a lot of gatekeeping in the medical system.
Yeah.
And getting to that specialist is really, really important. Okay. So you want to get to somebody, first of all, you want to get to somebody who deals with genetics.
Yes. Geneticists, rheumatology.
Yeah. But I haven't had good luck with rheumatologists other than the one I seen with Lacroix. He was good
Yeah.
because he seen it. He had seen it before, and
Okay.
so he knew. But many didn't. So um, I'm thinking the best is to ask for genetic testing and somebody who specializes in connective tissue disorders.
See, we're really lucky in Ottawa because we have a children's hospital here, and it's usually in children's hospitals where you'll see most of the geneticists because genetic conditions happen as babies, right? And so we're very, very lucky to be able to have that here, but not many cities have
No.
that.
Oh God. When I was growing up, there was nothing. I mean, I was
Yeah.
you know what they called it? I was growing pains. Oh, you're fat. You're too fat. The nurse, the school nurse used to come around and used to check your head for nits and weigh you and stuff like
Yeah,
that. Do you
yeah.
remember this?
Yeah, oh yeah, I've been there. Yeah.
Well, the one that
Yeah.
we had, she was a real bitch. Like she
There-
was like the most honest to God. You want to talk about medical PTSD?
it goes
When I
back.
was in line waiting to
Yeah.
go see her, I I was mortified because I was such a fat kid, right? Like I was a
Yeah.
really big kid. I was a size, like I said, what, 52 when I was in grade 3.
Yeah.
And she would shame me. She would tell me
It's
how fat I was. Oh, you're really fat. And I'm like, yeah, I already know. Everybody else tells me like all day. Like, I don't need you to tell me. And I
right,
remember
just
her,
like bullying on top of
yeah. So
bullying.
all of the growing pains was blamed on the fat.
Too many people in our community experience that, I think. It's just, well, if you lost some weight.
Yeah. Well, I'll
eh,
tell you that
yeah.
losing weight does help. Okay.
Yeah.
So I just lost roughly, I think, 40 pounds. Um, and I'm still losing.
Yeah.
And I do feel more compact. Let's put it that
Yeah.
way. And less, I'm more agile because I'm more compact,
For sure.
more muscular because I've worked on that, and that's been painful.
Yeah.
But it's the payoff was grand. So, but at the same time, I mean, there's so much shaming that goes on. If they see you're big, like a
Yeah.
doctor sees you're big, or you're way off your BMI, which is like mine is deadly, by the way. I think I'd look like a scarecrow.
It's
Um,
ridiculous. The
yeah, it is.
BMIs, like
Like
I don't know why people
for a
still
woman like
no.
you too, because you're really big. Like you're
I'm
built.
like I'm curvy. I'm yeah.
Yeah.
And I've gone through like I
Your
at my
bones weigh more than your
smallest,
bones and your like pelvis weigh more than your MRI does. Than your BMI does. You know, your
it's
BMI,
honestly
it really
ridiculous.
is. It's like it's a really we've outgrown it as much as we've outgrown the Biden scale for
Yes.
diagnostics for EDS. Um, but and only the EDS people are going to know what we're talking about. But it's a
Yeah.
scale they use to figure out how hypermobile your body is.
Yeah.
But with you,
I,
I mean, you're a big girl, so you're going to be heavier.
and you know what? Like through my we'll talk more about this next episode because we're going to be talking about nutrition and stuff
Food,
and food, but
food.
I've been at my lowest like under 130
Oh
and
God,
at my
what?
yeah, yeah, like I'll show you pictures after how tiny I was and all you
Oh,
see
this would
is
not be
tummy.
good.
No, and so I actually
Scarecrow,
lose
Cristie.
yeah, but
Yeah.
that's probably where my like the amount of times when I was that skinny where people would tell me how healthy
Like what?
I looked
Yeah. No, no, I
and
know. I know. No, no, no. What?
I've
Wait,
now gained like in that process of my surgeries gained 60 pounds
oh, no
within
way.
that.
Wow.
Yeah,
Because what are you? A size 12?
yeah, probably like
Yeah.
large, X large.
I find like
Yeah.
size 12, like when it comes to a woman, like I'm going to totally give the man opinion here.
Yeah.
Like size 12 is like the best. Like
Well,
curve.
because it's
It's
healthy.
got the
There's curves
curves and
and
it's got,
there's some meat on my bones.
yeah, there's
Yeah.
some butt there and so
Yes. Yes,
fucking,
yes.
I'm always so jealous of curvy people because I've got this bored straight body that I've been trying to twist back into shape again, but it's happening. But the thing about that is that, yeah, fat shaming, it's like the worst thing in the
It's
world.
yeah.
If
And it
you're, and if you are overweight and you have EDS, you're doomed because every doctor is going to say, oh, it's because you're too big. You're going to have to go lose the weight basically before they'll listen to you.
see, I was lucky that I got the EDS whatever diagnosis prior to this weight gain. because, like, honestly, my weight gain was because of starvation, actually, because I wasn't able to eat. And so then everything was just, when I did eat, it would store as fat
Because your body had been
because
going
my
for so
body,
long and it was
yeah,
trained to go, okay, when we are getting
in
food,
starve,
we need to store it as fat
we
so we
need to
can use the
hoard
fat
it.
for energy.
Yeah.
Right.
And
Yeah.
so that's something, has been part of the journey in the last few years. But it it did add to my pain. And I'll be honest, like that extra weight, it it wasn't even about visually how I looked or the number on the scale.
Mm.
It was how it made me feel. And I was in significant more pain when I had the extra weight.
Oh, listen, I
Yeah.
was getting big, right? We'll talk
Yeah.
about this more on the nutrition episode, but
Yeah, for sure.
I was getting big. And because I was just basically up here in the country, watching the world, blow itself
Mm,
up and
right?
eating myself into oblivion.
Yeah.
And I was eating a lot of stuff that was causing inflammation. Not just, it wasn't just,
Yes.
I wasn't just gaining
Weight and
fat.
yeah,
I was provoking
for sure.
inflammation.
Inflammation.
Um, and I think that once I started to realize, I'm like, oh my God, but this is where we go, right? When we go to the
Yeah.
doctor, you got to remember that a lot of this is diet and food based, and they don't really have a big education about this stuff.
They really don't. I spent a lot of time working with a nutritionist, and that's where she was like, "Cristie, you're not even getting like half the amount of calories that you should be and the
Right.
amount of protein." So, but yeah, we'll talk more about
So
that
then you
tomorrow.
hear
But
that and you go, oh
yeah,
my God, that gives me PTSD because I don't know whether I'm doing anything right or wrong. I don't know what I'm doing is helping or hurting. You
yeah,
know,
because I'm like, why am I gaining weight when I'm not eating?
yeah. No,
It's
these are the things, right?
yeah,
And
they're
doctors are pharmaceutical people. They're
yeah,
highly trained on how to prescribe pharmaceuticals that will rectify your condition, but they're
yeah,
not highly trained on prevention.
exactly,
That's the problem. And with EDS, there's a lot of things you can do that will help you prevent, right?
for
And so,
sure.
so back like to the whole,
Back to the
the whole
PTSD
going to
and
the
the
doctor initially
yeah,
and what do I do? I do make a list. So if I
yeah.
have Michael does actually. He helps me
It's
with this.
important.
So he keeps a little list, and when we go to the doctor, we remember everything that I
Exactly.
need to do, right? And that kind of helps. And I'm saying, and I'll say to my doctor, so I have a little list here. Are you willing to? Do you have time? Yes, and we go
Exactly.
through the list.
Yeah.
But do go in prepared.
Yeah.
You don't have to, from my point of view, you don't have to diagnose yourself.
No.
That's, I think that's their job. But I do think in the back of your mind, if you've done enough research and read enough things, you know your own body, you know how you're sleeping, you know how
Yeah.
you're eating, you know if you're depressed, you know if you have anxiety, you know
Yeah.
if you can't poop, you know if
Yeah.
you're throwing up, you know if
Yeah.
you have nausea. So you're going to plug all this stuff in. And it's
Yeah.
probably going to come back with saying that you have something like this, a
Yeah.
connective tissue disorder. Because if I listed all of my problems right now in
Yeah.
ChatGPT, it will come back and tell me I possibly have a connective tissue disorder.
Yeah.
So go in with that, but make sure you're always saying like, look, I have this. This is what I am experiencing. What do you think this could be? And always put the ball in their court.
You know what? I think that it's also building the rapport with your doctor, because after a few years working with this doctor and all the things that I was having,
Mm-hmm.
it was actually like my uncle that brought up EDS. I had never heard of it before. And at that point, I was working with my doctor for a few years, and I brought to her and I said, you know what, could I have something like Ehlers-Danlos syndrome or another type of connective tissue disorder? And she was just like, yeah, it made sense. And so building that rapport to be able to, you're the expert of your body. And I say this all the time because that's what I've learned in this process is that, but another thing
But that's
that I'll say,
that's the most difficult thing to
it
master.
is,
What you're talking about there. So many people are going to go, "Oh, these two think they know it all." But you know
and we
what? We
don't, we
don't. And
don't.
the thing is that we had to start like you heard. I had to start being told I had HPV in
Yeah,
my rectum. That's where I
yeah.
started. I actually
And
started before that with a doctor who just didn't even call me back with my test results.
I mean,
Like
there's
it
so
was
many
so
instances of that.
the fight that you have to do, you really have to be prepared. You have to be prepared when you have something like this that's invisible. We call this an
Yeah,
invisible illness because you can't see it.
yeah.
other than
But
when you have an MCAS thing, your whole face swells up or something like that, which is
exactly.
something that happens, by the way.
I've been there for
Me too.
sure.
Me too. I get like wicked. I'm allergic to flies, like black flies. And look where I live. I can't. If I
Wow.
went out for a hike one time and I wasn't prepared. My own stupid fault, and I got bitten multiple times. I ended up in bed for 3 days.
I can imagine that.
Massive MCAS reaction. I didn't know what it was. Mast cell activation syndrome. It's when your immune system goes ape shit and attacks your
Yeah,
own body, basically, is in a
literally.
nutshell. But so yeah, so there's all of these things. And if you know, this is why getting through the medical system is such warfare, because there's so much to consider here. And there's so
There,
much that the doctors don't even know about yet.
there, honestly, one of the things that I find that has helped me deal with that, because when you're talking about all these things, it comes with emotions, it comes with grief, it comes with sometimes panic.
Yeah.
Uh,
Panic. That's a good word.
and so, what I've learned for me that has helped me kind of show up as the expert is that I let myself feel my emotions. And because I used to get very overwhelmed and emotional
Yeah, and
at appointments.
it's like having a little jar that says emotion,
Yeah,
and you keep adding to the jar, and then you
yes,
know what happens,
it's
because
going to
you
overflow.
run out of the room and you have a freaking meltdown, right? I'm trying
Exactly.
not to say the F word, by the way. I don't know why. The whole world's gone to fucking hell, and I'm really worried
Right?
about
Like,
saying
what the
fuck.
fuck?
So anyway, not to, sorry, ADHD with Drake. Anyway,
Right.
so
But
back to Cristie.
no, but like, I really found that being able to say, like, yes, I'm going to give myself, and it's not ongoing and every day, but I allow myself the space and the time to be like, this is a lot. And it's okay to cry about it.
Yeah, I'm
It's okay
terrible.
to be mad about it. It's okay to have whatever emotions you're feeling. That's normal.
So I'll
And
tell
it's
you,
okay.
me, I'm a total man when it comes to that.
Yeah.
I'm sometimes like, you're gonna push on. You better
Yeah.
keep going.
But how
Doesn't
does that help you with the putting on that heavy, like,
It's
he-
counterintuitive,
right?
but that's the
And
man problem. We do shit that's counterintuitive. That's I
I think a lot of us do,
well,
especially
I
in
just
this
but
like
I, I'm a man.
situation.
I can say it.
Yeah. Yeah.
So, but so I'm just like, sometimes I can be my own worst enemy and just press and press
Yes.
and press and press and press until, like, I'm exhausted. And that journey through
Yeah.
that first couple of years of diagnosis was exhausting.
It is exhausting.
And
And that's
we're not making it simple. We're not saying it's easy. It's not. It's very, very difficult to address this
yeah.
with doctors and some of them have no understanding of this.
And some of them can be so condescending. And that's, I think, where I felt the most unheard and like emotional was
Mm-hmm.
when they just dismiss you like that. And it's taken years. Like this process for me to get here, it's over 10 years
Yeah. Well,
of
for me, yeah, since I was 25.
I mean, I've had issues, honestly, since the day I was born. So really, it's something. But like the real
It
key,
starts when you get your ass slapped and you take your first breath.
pretty
That's
much,
when EDS starts.
literally,
If you have it, this is when it starts.
you've had it from day one. It's
Just
not
didn't know.
something
I didn't know.
exactly.
We didn't know. So
I was told I was even with a dislocated hip was told, oh, you're just double jointed.
right.
Really?
Yeah, well, this is what they told
Like,
me. And then they said I had this hypermobility syndrome. I'm like,
yeah,
well, that sounds like a crock of bullshit. I'm going to move on and just live my life.
yeah.
Which was not the best advice to myself. I really, really stunted myself. I should have looked into it more. But back then, we didn't even have computers in our house back then.
Exactly. I mean, that's the thing.
We
And
didn't
we had
know.
encyclopedias.
We
Like,
trusted the doctors like we trusted the
yes.
priest. That's the
And
way it
look where
was.
that got us.
Well, it didn't get
But
us very
that's a
far.
whole, again, another
That's a whole
a
other
whole other,
episode. Yeah.
right?
So,
It
so
is.
let's wrap it by saying, like,
Yeah.
totally, like, what, so going to the doctor the first time, make sure that you you know, have done your research,
Yeah.
and that, you can compare something that you've seen.
Yeah.
So one of my things that I did, so I'll say this is my contribution. Go to
Yeah.
the Ehlers-Danlos Society of North America's website. If you think that you have any type of EDS, go there first and look at all the
Yeah.
resources. They have all kinds. And the people at the EDS Society are great folks. Really, really nice.
They are.
We just
They
got
are.
back from the major World Scientific Symposium, and it was
Yes.
so great to be there. And it was such a nice thing that both of us were guests on the stage with such esteemed people.
it was an incredible honor,
Right.
really.
So, and
Yeah.
you can get where we are. You can do all this stuff, and
Yeah.
because I just started on a patient journey. So,
Yeah.
and you too, same thing. So, go to the Ehlers-Danlos website, have a look at their resources, look about what they say about the pathway to diagnosis. Talk to your doctor, make those notes. Buy
Yeah.
yourself an Apple Watch if you think you may have POTS.
Yeah.
You know, there's a lot of things you can do.
Bring someone with you so
Yes.
that it's someone else that can bounce back. Like, did I hear that correctly? Like, did I understand how they were saying it? Just having that extra ear listening for you, it really, it is beneficial
Yes,
and
and you
it's
get
helpful.
and always be honest with your doctor and say, "Look,
Yeah.
I acknowledge the fact that you have a rule here, if your doctor has this rule, that I can only talk about one thing. But unfortunately, I think I have a bunch of things that are connected to
Yeah.
one thing. So can we talk about that?
Yeah.
Be honest.
Sometimes they will, and
Yep.
sometimes, unfortunately, they won't.
Put
Like,
it
I
on.
want to give a shout out to my GI, Dr. Saluji, because he honestly, he's been with me. He's the doctor that's been with me the longest in my journey, and he's such an empathetic, sweet gentleman. And he's never once made me feel like,
Uncomfortable.
okay, wrap it up.
Yeah.
Like, it's time to go,
Yeah,
lady.
he's like my GP.
Like, yeah.
My GP has
He's
like
called me at
thousands.
8 o'clock at night, and I'm like, as he's driving home,
Oh,
because he cares enough.
yeah. That's the way my GP is. My GP
Yeah.
is there all the time. I know if I have a major emergency, he'll be there for me. He's a great person.
So
He's
there
a
are good doctors out there. There
lots. I've got my
are. There really
chiropractor, my
are.
neck chiropractor is like a saint. Love her. And my the doctor that diagnosed the EDS last year, she's great. Shua Basalam. She's Dr. Shua Basalam. She's really, really sweet. And my doctor's name is Dr. Lego. He's a great guy. He's a wonderful person who's taken great care of me and helped me navigate this. So I'm very grateful, like you are, about your GI guy.
Yeah. The one other thing that I would just, as my last thought here, is connect with your community. Like, I learned so much from the EDS community and people in groups on Facebook and meeting people at the conference. It gives you that power of being like, it's not crazy. All these other people in my community have experienced the same thing. And so community is huge for us. And it has been a huge benefit to me.
It was a really enlightening thing to meet other people. Because when you
Yes.
start, because you got to remember now, what's happening to somebody that has EDS can be one thing. And
Yeah.
because your genetics are so different. And remember, we're back to the zebra thing we started with.
Yep.
Remember that everybody is different. Stay the course.
Yeah.
Use medical diagnostics to prove your point and make sure that you get to the right people. And if somebody says no, you got to keep going. You got it next. I always say no means next opportunity.
Yeah.
So, and it's hard to keep pushing. Yes. And sometimes you may have to go private. If you have to go private, look at private resources, look at the best private clinics in your province or your state and go there and start your journey that way. And then maybe somebody in the system will notice, like what happened to me. I got lucky. But I kept pressing. So the big thing is to stay the course, and it's a bit of a fight. We won't lie to you. We're not going to paint this with pretty brushes or anything like that.
It's not easy.
It's not easy.
But it's worth it. And like, our friendship, I appreciate so much because I've learned a lot from you. And this is, we share, we learn.
Yes.
And that's what community for me is about right now.
And hopefully
I think it's so important.
And that's why we appreciate all you out there listening. If you listen to this point, you are listening to season 1, episode 5, I think, if I'm not mistaken.
Yes. And we appreciate you for supporting us and being here with us.
Thank you. And leave us a comment and hopefully something we said in all of our babbling will actually resonate with you. So you've been listening to Ben Snap and Chat with Drake, Jensen, and
Cristie, Vito.
And we're going to see you the next time. Tune in for our next food episode where we get to talk about Big Macs and all of the things that you just can't eat no more.
I can't wait.
All right, Cristie, have a good night, girl. We'll talk to you soon. You too. All right, bye, everybody.
Bye.